and welcome to Speaking of Caregiving. I'm Ben Ehrman, your host of Senior Resource Association's talk show. Each week we will discuss topics that will help you and your family to meet the demands of daily caregiving. Thank you as always to New Vision Eye Center of Vero Beach for sponsoring our show and for all that they do for us at Senior Resource Association. If you are in need of some great eye care, definitely check out New Vision Eye Center of Vero Beach, located directly across from the Indian River Medical Center. So, it is a new year. We have a brand new set of shows for you. I can't believe that it's been a full year since we started this show. Thank you to all of our listeners and everybody that has supported this show, and for all of your ideas and suggestions and all the guests that have appeared with us. And we are starting off this year with a great show with a wonderful guest, a wonderful person around the community. Vicki Soule, the CEO of Treasure Coast Community Health, joins us today to discuss the importance of Treasure Coast Community Health in our area and all the resources that are available to everybody throughout Indian River County. So, Hi, Vicki.
Hi, Ben, and thank you so much. What a great intro.
Thanks.
Now, when I started 100 years ago as a lowly med tech, I never thought that I would be here in this place, but I think it's where God meant for me to be.
Great. We're so happy that you're here, and we're so happy that you're involved with this wonderful organization. But side note, you also have your own radio show with Treasure Coast Community Health. So we're swapping seats here today.
We are. So if I take over, just say, no, you're
problem.
The
guest. So give us a little bit about your background, where you come from, your history, and how long you've been with the company.
Boy, I'm so old it would take us the whole show. So I'll give you the Reader's Digest version. Okay. I was born up in Michigan, spent a lot of my medical career up there as a med tech, and then as a professional that started learning much more about the job of healthcare, and ended up in Vero Beach about a dozen or more years ago. Because my in-laws lived in Barefoot Bay, and I got tired of doing the snowbird thing, coming down and spending my vacation helping repair roofs and other things I really needed as a senior. So I am very grateful for all the work that Senior Resource Association does.
Thank you.
We were unaware of that at the time. But again, God works in mysterious ways. And one day I said to my husband, we're doing this backwards. We should be living down here and going someplace else for vacation.
Right.
And he said, well, if that's meant to be, it'll be. So I put in an application at Indian River Medical Center. And a month later, I was interviewing. And 2 months later, I was down here as the Director of Diagnostic and Ambulatory Services.
Wow.
And spent 6 wonderful years there. Our family dynamics changed a little bit, and I was recruited up to Ormond Beach, working for the Adventist Health System. But our heart was still here, as well as our house. And so after about 18 months, it was during that time where housing kind of went upside down, we decided to move back here. And at that time, the new CEO of Treasure Coast Community Health, a wonderful man, Don Loftus, and I connected, and I agreed to help him build what is now known as our Oslo Road facility.
Right.
And Don, unfortunately, had an earlier retirement than he expected, and I threw my hat in the ring along with about 80 others.
Wow.
That's the way it works under community health systems. The federal government gives you a small amount of money in exchange for a lot of control.
Sure.
We all know that.
Right.
So that is what it is.
Yes.
And so I've been their CEO now for 7, almost 8 years. Wonderful board of directors, wonderful community. Have not regretted a minute of it.
That's great. That's great. And so it is a nonprofit, correct?
It is a nonprofit. And a lot of people get confused about that because they hear federally qualified health center and they think that we're very similar only at the federal level to the health department. And in actual fact, the health department has been around for hundreds of years, whereas community health centers were a pilot project that evolved at the time that JFK in the early 60s was challenging all of us. Ask not what you can do, what your country can do for you, but what you can do for your country.
Sure.
And so 2 physicians, Drs. Geiger and Dr. Gibson, who had explored other public health models, suggested to his younger brother, Jack, that he support a pilot to see how it would work in this country. And that is healthcare for all, but with a local control and local interest in what's going on. Because the way public health is dealt with in the urban areas is very different than perhaps the needs of a rural southern community.
Sure.
And so that is really what we have done. We have a board of directors that is consumer run. The majority of our board members must be users or consumers of our services. And again, by federal stipulation, our board must be no less than 9 members and no more than 25. And our board really has some folks that have been on what they call a lifetime term, which they're very proud of and should be because they have guided us in our history. But basically what we do is try to allow people to indicate what their real needs are. And in our particular community, we know that translation services with our migrants has long been a barrier to care. Transferring care also from spot to spot in terms of transportation has always been an issue, although it certainly is now much less of an issue since the GO line has expanded and community coaches there. And actually in the last couple of years through Obamacare, as people call it still, the Medicaid groups are also offering transportation assistance. So what we have done is really wrap our services around some of the others that are out there and continue to try to remove barriers to care.
Which is great, which is a lot of what, Indian River County and everything in Vero and Sebastian and so on does, is that all of these kind of organizations do work together. They have some sort of connection with each other, and you go to them as well, all the networking events and all the Be Seen events, I guess you could say, that we all go to. And we say, it's not competition, but it's more of building a network and working together because there is a way that we can all work together to help the community.
Absolutely. The resources for all of us are too scarce to duplicate services. Sometimes there is an overlap that feels a little like duplication on the surface, but the reality is we try real hard not to compete with each other.
Absolutely.
There's plenty of people to go around.
That's right. Because Vero is growing and growing and growing all the time. So I think that what you guys do is a wonderful thing, obviously, for the community. And I hear it said all the time that Treasure Coast Community Health is healthcare for all.
It is.
So that means that you will take anyone.
We take anyone, everyone, from newborns all the way through end of life, as well as those folks, regardless of their financial circumstances.
I was just going to say, because that is, I think, the key is that regarding any sort of financial circumstances or insurances or whatever the case may be, they're still going to be able to be seen by your company.
We know that finances, despite the injection of Obamacare and in some states the expansion of Medicaid, the biggest barrier to health care is financial.
Absolutely. It gets so expensive.
It is, like everything else, but it seems to triple, or so I'm told. The reality is that we know those are barriers. And so the very first thing we do is evaluate someone's financial circumstances in the privacy of a closed office with our health navigators. This is someone who is very familiar with the community. There's a financial or health navigator in every one of our centers. And they are connected to a lot of the nonprofits, a lot of the resources, as well as being able to talk plainly to people about what we can do for them.
So do you consider them like we have case managers, someone who was taking on a client and helping that person?
Well, we actually have care managers as well, but our care managers are more from a clinical point of view. But these health navigators are really the social services arm. Okay.
And you keep talking about locations, and I know that everybody, has probably seen your locations, but there's new ones that just got put up. But tell us about some of the locations that you are in within the county.
We started out in Fellsmere. That was our first location for the first 10 years. Yes.
Oh, wow. I didn't know that.
Yeah, because that's where the migrants were. And they put in such very long hours that, and they didn't really have anyone other than a volunteer physician and a volunteer nurse from the health department. That's how our origins started. So for the first 10 years, we did that. And then in the post-2004, 2005 hurricanes, where so many of our buildings along the riverfront and lagoon front are or were either blue top tarps or water intrusions from the ground up, that many of the facilities here in Vero and to some degree in Sebastian were affected, and patients were finding their way out to Fellsmere because we're west of the expressway and we're not as seriously impacted. And that gave our board of directors at that time some real thought about, we're receiving some federal funds and a lot of benefits for the entire community, for the entire Indian River County service area. Should we not be down in that area? So our CEO at that time came down and looked and, of course, found the same thing. There weren't any really great buildings. Big surprise.
Right.
So they start considering land. And at the same time, they recognized that being Fellsmere Medical Center was not where they wanted to keep their name. They really had a broader vision, and that was as Treasure Coast Community Health. So the short answer was they adopted a contract to buy land on Oslo Road, and that was our second facility.
Right.
And since that time, we've been filling in the blanks because one of the primary purposes of a health center is to be where the people are. And so we have since added different locations to become closer to where people's neighborhoods are, where the need is the greatest.
You have. You just added one in Sebastian, correct?
We did. That's so exciting for us. Because we were in Sebastian a few years ago. We opened a pediatric spot. But it really was off the beaten track, and it was not very well received, so we closed it. And yet, if you live in Sebastian, going all the way out to Fellsmere, or all the way down to Central Vero, and again, I have to chuckle because as a Midwesterner, all the way is usually more than 10 miles, but it really was a barrier, and so we're very excited to be there in the Roseland Road Plaza there at Roseland Road in US 1.
So these services are available to everybody, so there's no excuse to not be able to see somebody, to be able to provide you with some great health care. So you have a location in Vero, on Oslo, you have Fellsmere, you have Sebastian, and there's all these wonderful buildings for you to be able to go and check out, and if you are in need of some great health care. So we are going to take a quick break, and when we come back, we will continue more with Vicki Soule from Treasure Coast Community Health.
Did you know that loose skin over your eyes can make you look tired, sad, or older than you really are? Eventually, your vision can become partially blocked. Your eyes are the most important part of a first impression. Make the most of them by consulting with ophthalmic surgeon Dr. David J. O'Brien. Look and see better. New Vision Eye Center in Vero Beach, providing world-class eye care on the Treasure Coast. Call 772-257-8700 or visit newvisioneyecenter.com.
For keeping your house pest and termite free, as well as your landscape healthy and green, call Compass Pest Control. Hi, this is Brian Combs, co-owner of Compass Pest Control. We are locally owned and operated with over 60 years of experience. We provide personalized, reliable service to all our clients. Call Compass at 772-925-1740 or visit our website, CompassPest.com. That's Compass, PESTS.com.
It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual bottles of water in 8 or 16-ounce bottles. No more lugging it home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. Easy for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew.
Finally, it's arrived in Vero. A1A Fingerprints comes to you. Are you a nurse, CNA, child care worker, massage therapist, school volunteer, realtor, or lawyer? The state of Florida requires a fingerprint background check for your state licensure and renewals. We make it easy with walk-in, same-day service, and no appointment necessary. If you are a healthcare facility, we'll come to you and screen all your new hires with the fastest turnaround time and also bring your current staff up to date. In a recent law expansion, all massage therapists must now be fingerprint background checked effective July 1st, 2014. Visit a1afingerprints.com or call 772-494-6556. We're here to make your fingerprinting easy. A1A Fingerprints. If you're a healthcare facility, we'll come to you, saving your employees the trip. We have same-day mobile services available. A1afingerprints.com.
back with Speaking of Caregiving. I'm Ben Ehrman, your host. Thank you, as always, to New Vision Eye Center of Vero Beach for sponsoring our show. And if you're just joining us, we have a great show going for you today. The first show of the new year for us here at Senior Resource Association with our new show. No, not new anymore. It's a year old now. Speaking of Caregiving. And I have a great guest today, Vicki Soule, the CEO of Treasure Coast Community Health. And we're discussing all the wonderful things that they do within our community all throughout Fellsmere, Sebastian, South Vero, West Vero, and all the resources that they provide to everybody here. So we were discussing your locations, how it started, how it branded, and everything that it provides. And I think to be clear, I think we need to let people know that there is some sort of amount that they do have to give towards their services. However, it's not expensive as going into...
Oh, absolutely not. You know, we see people from all walks of life. Many of our patients do have insurance, whether it be private, like a Florida Blue Cross,
right.
Medicare, Medicaid, all of the Medicaids, actually.
So do you take all? You take all?
We do. We take everything.
All
and
insurances.
actually, we've had so many people come in year after year from up north that we take a lot of out-of-state insurances as well. So if that is a question that you have and you want to establish care with us, we'd be more than happy to help you do that, again, through our health navigators. But we also offer a sliding fee scale discount for people who are not insured. And the way that works is anyone under 200% of federal poverty level, based on their family size and income, is qualified for a discount off of our regular prices, which are about maybe 5 to 10% less than private. So it's pretty close. We're not looking to compete with them either. But the discounts can be very substantial, right down to 100% or less of federal poverty. We don't charge an actual fee, although we do ask for a nominal amount, and we give you that suggested amount. For behavioral health people, for example, people who need counseling or some medication management, that fee is only $5.
Wow.
For medical and dental, it's a little bit higher. Again, we feel that people should put a little bit of skin in the game when you actually contribute to your own health care. You're probably more likely to stick with whatever the advice is.
Sure.
So we do try to make it affordable in all ways and kinds. We've even set up payment plans for people to have dentures, done all kinds of creative things because we really want people to get the health care that they need.
It's so important. And today, you know, we're all so busy and doing stuff, and sometimes we don't pay attention to that as much as we should, because we feel, you know, we can't afford it, or I just can't, you know, I don't have the time for it.
Well, there's a ton of barriers, not the least of which is working.
Absolutely.
So to that end, you know, because our consumers are also our board members, they point out things like you should have at least one day at every location that has early hours, so I or my child could come in before school or work, as well as some evening hours. And dental is open on a half day or 3/4 of a day on Saturday as well.
That's great.
Because that's such an important aspect that most people don't get to partake in.
Absolutely. So you take all ages, you said. So let's talk about a little bit of the services that are provided specifically geared to our senior population, which is what is growing.
I'm so glad you asked. Because we just talked about the financial aspects of it. And for our seniors, because we are a federally qualified health center, a lot of our benefits come in non-cash ways. And one of those is actually cash on behalf of the patient. We do not collect deductibles from our Medicare patients. So as long as you are seeing a Treasure Coast provider, we will not ask you to pull that $180 out of your pocket over several visits. Wow. So that's a great benefit for them. And we also have dual enrollment folks who have both Medicare and Medicaid that we accept, or Medicare, Medicaid sliding fee scale. So we are very creative in trying to give the lowest amount possible for you to receive the care. Of course, free care would be even better, but I'm not sure how long we could sustain seeing the number of people that we have over the course of every year.
How many people do you think you see?
Well, I just looked at the 2017 numbers this morning, and I called my IT person and said, "Are you sure this is right?" Because it was well over 19,000 unduplicated individuals.
Wow.
Which means some of them may have come in once or twice, some may have been in a dozen or more times, and we only count them as one. So over 19,000.
Wow.
So about 1 in every 6 or 7 individuals within the county comes to our providers. And it's because they are board certified or board eligible. We pay them. They're not people who can't get a job elsewhere. There is no lack of quality amongst them in terms of what they do and how they do it.
But we see that in this community. Vero is a very wealthy community, but then Vero also has that, middle class, the poverty level as well that still needs that attention. And Treasure Coast Community Health is definitely here to be able to help them out.
Well, our belief in healthcare for all is that we ought to take the highest road, not whatever.
Sure. And I think that it is wonderful that it is here and that it's existing. And it's been open for how long, you said?
Treasure Coast Community Health actually was formed as Fellsmere Medical Center in 1993.
Wow.
So this will be our 25th anniversary year coming up in April. Yes.
Well, happy anniversary
Well,
year.
thank you very much. I don't think anyone expected it to be this 25 years later.
And it's growing, as you said, it's adding new locations. And you have how much staff, you said? We were talking during the break.
A little over 200, about 225. There were 42 when I started. Just the folks in Fellsmere. They were one tight family. They still are. Right. But a lot of folks have joined our ranks to help.
And it's grown that much.
Yeah.
And that's wonderful. I think that your organization is wonderful. And I know that, Senior Resource Association and us, and we work together. And your staff is wonderful. I've met many of them. So again, to recap, Treasure Coast Community Health is available here to folks within Indian River County in locations in Fellsmere and Sebastian and Vero.
That's correct.
And they offer all sorts of medical services as well as dental.
Dental and behavioral health.
Behavioral health.
We do counseling. We also do medication management for people who have substance abuse disorder, whether it's alcohol or opioids. So we also see children with ADHD. We have 2 board-certified psychiatrists for children and 3 for adults, as well as a plethora of counselors. So, again, we're trying to meet that need as it's been recognized. I want to circle back just one moment, if I could, to the seniors, because there are a number of other things that we have identified that have caused some concern about where they get their care and how they get it. Things like folks taking Coumadin and utilizing a Coumadin clinic, or folks who have other needs. Dental care, for example. A lot of seniors, unfortunately, have dentures, but they need to come in and get an oral exam. We're finding a lot of oral cancers in early stages, working with Scully Welsh to take care of that. Diabetics, we have some medications that are very heavily discounted, and we do things like foot checks and diabetic eye exams to do a retinal screen to see if the diabetes has been consistently leveled, and if not, work to help people do that. Again, working more on the prevention than the identification and treatment wherever possible.
Right.
So when we do have to refer out to specialists, we do, but we've incorporated a lot of things that folks would not consider part of primary care. Again, maximizing the one-stop shopping aspect as long as you're over there with our folks.
I think that's great. So give everybody a number to be able to contact and reach out to Treasure Coast Community Health.
Very easy. 257-TCCH.
There you go.
So, I don't get to say it very often.
Right?
So grab a pencil. I'll give it to you again. It is 772-257-8224. Our Facebook page is tcchinc.org, as is our website.
TCCHI
NC like incorporated.
inc.org.
Yep.
That's a website.
And then Facebook covers the same.
That's wonderful.
Okay. So we have a lot of great information there. Help yourself and call us anytime.
You do. Wonderful information. And we could go on and on. You've been a wonderful guest. And I know that there's other things that we will definitely talk about, but we will definitely have you back on the show. So thank you so much for joining us today.
Really appreciate it.
I appreciate it. And thank you, as always, to New Vision Eye Center of Vero Beach for sponsoring our show. Next week's show is all new with a new guest and new topic, so be sure to tune in. And if you have any questions, you can email them to info@sramail.org, and we'll be able to answer them for you on air. Thank you for joining us on Speaking of Caregiving. We'll talk again next week.